Assalamualaikum and hi everyone. We are Group 6 and today we're presenting on the impact of the nurse-patient ratios on the quality of care. Our topic focuses on how the number of patients assigned to each nurse can directly influence the safety, satisfaction, and overall quality of nursing care. We choose this topic because staffing ratio is one of the biggest challenges faced by the nurses. It affects not only patients' outcome but also nurses' overload and mental well-being.
Hello everyone, we are from Group 6. I'm Yusmawati Noor, joined by Inusha Naik, Nuriwani and Nur Farahin. Together, we collaborate on the literature review exploring nurse to patient ratio on their impact on quality care. We are excited to share our finding with you today.
Before we begin, here is a quick overview of our presentation flow. We will start with the introduction, followed by our sources overview, then present the findings from the primary and secondary sources. After that, we will share our thematic mapping and finally conclude with key reflection from our group.
This section provides an introduction to the literature review on the impact of nurse-patient ratio on the quality of care. It's focused on how staffing level influence patient safety, clinical outcome and nurses' workload. By reviewing previous study, this review identify pattern, similarity and existing gap in the current evidence. Understanding this connection is essential because it highlights why safe staffing policies are so important in healthcare. Ultimately, the findings aim to guide future research that will help improve healthcare delivery, enhance patient well-being, and support nurses in providing safe and effective care.
For this review, our group searched several databases including PubMed, Search Journal, Google Scholar, and ResearchGate. We used keywords such as nurse-patient ratio, staffing level, nursing workload, quality of care, and nurse burnout to identify relevant studies. A total of 6 articles were selected. 3 primary sources published between 2018 and 2025, and 3 secondary sources ranged from 2011 to 2025. We included only English language studies conducted in hospital or clinical settings and focused on the relationship between nurse-patient ratio and quality of care. Articles that discuss non-nursing ratio or community settings were excluded. These 6 studies form a foundation for our thematic synthesis and analysis presented in the next slide. For the primary sources, our review focused on studies that examine how nurse-to-patient ratio influence nursing outcomes, patient safety, and satisfaction. These studies were conducted in countries such as Chile and Saudi Arabia using quantitative cross-sectional design with large sample sizes of nurses, patients, and hospital records. The findings show that lower nurse-to-patient ratio, meaning few patients per nurse, lead to better outcome, including reduced mortality and readmission rates, higher patient satisfaction, and stronger nurse engagement and empowerment. However, all studies were cross-sectional, so causality couldn't be established, and most relied on self-reported staffing data from single hospital setting. Overall, the primary sources provide strong evidence supporting safe staffing levels, though future longitudinal studies are needed to strengthen causal understanding.
Now, we will see the secondary sources. We synthesize global evidence on staffing ratio and nurse burnout. These reviews included studies such as Beyond the Ratio, Predictors and Impacts of Burnout among Nigerian Nurses, and the California mandated staffing ratio law. The main findings show that an optimal nurse to patient ratio is around 1 nurse to 4 patients, and outcomes worsen when the ratio increases. Burnout reviews reveal that poor support, low pay, and long working hours contribute to emotional exhaustion and lower care quality. Mandated ratio laws like California improve patient safety and satisfaction while reducing nurse burnout. However, these studies mostly relied on older and cross-sectional data and lacked update post-pandemic insights. Overall, the secondary source highlight strong evidence for safe staffing policies, but also the need for more recent and diverse research.
Thematic mapping impact of the nurse-patient ratios on the quality of care. This slide illustrates how the nurse-patient ratios have a direct impact on the quality of care. When the nurses are assigned too many patients, their workload increases significantly, leading to a higher mortality rates, more readmissions, and longer hospital stays. Inadequate staffing also contribute to missed care, delay, and a rise in clinical errors. On the other hand, when the staffing levels are adequate, we see a clear reduction in adverse events, better communication, and a higher patient satisfaction. The ratio also affects nurses themselves. Heavy workload increases burnout, emotional exhaustion, and turnover, which further threaten the patient safety. And however, when the nurses feel engaged and supported, it buffers stress and improve both performance and safety outcome. Overall, safe staffing saves life. It strengthens patient outcomes while protecting the well-being of nurses.
In conclusion, the literature clearly shows that safe nurse-to-patient ratio are essential for ensuring both quality and safety in nursing care. When nurses have manageable workload, patients receive better care and nurses experience higher satisfaction with less burnout. Adequate staffing not only improve the overall quality of care but also enhance nurse engagement. However, most study review were cross-sectional, so more research is needed to understand how staffing interact with healthcare policy and nurse well-being. Overall, maintaining safe staffing ratio is key to achieve effective, sustainable and compassionate patient care in today's healthcare setting.
Thank you everyone for your guys' attention. To summarize, safe nurse-patient ratios are not just a staffing decision, they are a leadership responsibility that protects both patients and nurses. With that, I'll welcome any questions and clarifications from the audience.